This is a review of the Medical Assistant Study Guide. Chapters 1 through 10 are your stars and underline important things. Okay, we're going to start on chapter 4, or page 4. Hippocrates is known as what? First woman to gain a medical degree. Germs are identified by whom? Mr. Lister did what? Antiseptic surgical methods. Penicillin discovered by who?
Sir Alexander
Fleming. Who developed the first vaccine for polio?
James
Who worked on the structure of the DNA molecule?
Francis Crick and James Watson.
Laws and ethics. Routine tasks for the medical assistant may include what? Vital signs, recording information, administering medications, preparing medical supplies, sterilization. What's the definition of sterilization? Destruction of all living microorganisms by chemical disinfectants or boiling for 20 minutes. Administrative duties for the medical assistant may include greeting patients, medical record keeping, answering telephones, filing insurance, scheduling appointments, arranging admissions, laboratories, billing, all kinds of stuff. Medical assistants may instruct patients about medications, administer medications, and call in prescriptions. However, when interacting with patients, a medical assistant should not discuss a patient's complaints with them or give a prognosis. What is a prognosis? It's the opinion to the probable cause and outcome of a disease. Being neat and also applies to the administrative field, as well as being organized, especially if the administrative working place is in view of the patients and free of clutter. Workplace and patient surroundings should always be sanitized, as bacteria flourishes where in
Hot and damp area.
and causes health problems. For your general care for a bedridden patient, support should be provided for what?
The back joints.
Other considerations. We should offer what for support?
Pillow.
If they're uncomfortable, lying on their side. What is a bed cradle?
The bed is laying on. They got the little thing to keep the sheets off the
Keep the upper beds off the patients. And air rings under the buttocks. What does that help? Pressure sores. It's the, toilet bowl looking ring. Medication administration. Certain medications are restricted by state and federal laws in their distribution, access to them, as they are controlled substances and can be abused. What is a topical administration? On the skin. Inhaled in the eyes, ears, mucous membranes. Enteral medication. Anything digestive. Digestive tract, swallowing, cheeks, tongue, feeding tubes, anus medications. Perineal. Bone marrow, muscles, into the skin, all of that is perineal. What is if you administer medications right beneath the skin?
It's a subcutaneous.
What is an anti-anxiety drug used for? What does penicillin do?
Bacteria.
It stops the infection from producing organisms. It kills the organisms. It does not halt or slow. It kills.
Okay,
That's going to be your difference. All of them wants to kill. Certain medications you need to refrigerate. What's one of them? That's the perfect one. Antifungal. What does it use to treat? Fungus, such as beta blockers. Medications used to do what? Reduce the oxygen needs of the heart. What's a famous hormone medication? Y'all should have it right up under hormones. Insulin. Name a sleeping aid. Melatonin. Ambien. What is an anesthetic? What does it cause? Called anesthesia. Administrative duties. The keeping, filing, and updating medical records of patients, such as vital statistics, are what? What are vital statistics?
Births, deaths, and marriages.
There you go. Schedule appointments for patients. Should be scheduled based on what? Patient's needs. Methods of filing can be subject by numbers, letters, date, places. Most times, subject, date. Know what a HMO is? They pay a fixed amount for a periodic fee. PPO or contractual arrangements which provide services at a discount. Remember that? Know what a diagnosis is? Opinion to the probable cause and outcome. I think we just wrote that one in. Vital signs. Know all your vital signs. In order to take and record vital signs, what do you need? What kind of equipment? You need that thermometer, sphygmomanometer, stethoscope, and your watch. The production and loss of heat are generated and controlled where?
In your hypothalamus.
And the brain stem. Unusually low body temperatures can be caused by what? Or problems with what?
Sleep pattern.
Your hypothalamus. Temperatures taken via the rectal temperature will be what degrees higher than your oral temperature? 1. Oral temperatures can be affected by what? Smoking, intake of food, drinking, chewing. All those. With the intake of food and drinks that are calorie rich, the temperature will do what? Increase. Physical activity can also increase body temperatures. A person's body temperature does what at night? Drops. Methods of measurement. Can you measure a temperature in the gut? Yes, they swallow a small thermometer. How long do you keep that thermometer, a glass thermometer, inside the mouth? 3 minutes. If it's electronic, you just wait till they beep. And we like those. The mercury thermometer, of course, is most accurate, but mercury is what? Toxic metal. And when we shake down, what temperature are we shaking it down to keep that thermometer right? All right. Know what a basal thermometer is? It actually measures basal body temperature at its lowest. Know what a fever is? Most of the time people have some type of infection, they get a fever. Basal body temperature, the lowest temperature attained by the body, usually during sleep. Know what hypothermia is? It's below 95. Hyperthermia, greater than 104. What is your normal blood pressure? Right in the middle. 120/80. Y'all know that. Systolic means that the heart is doing what?
Contracting.
And diastolic, it is doing what?
Dilatation.
Dilatation. They like that dilatation. What is the medical term for low blood pressure? Hypotension. What is the medical name for when they change from sitting to lying to standing? Orthostatic. If you have a severe infection, what do they call that?
A severe infection is septicemia.
Septicemia can cause septic shock. Some medications also lower blood pressure, and we already know your blood pressure meds do that, as well as your diuretics. We know about that. Postural orthostatic hypotension. What is postprandial hypotension?
A sudden drop in blood pressure when standing from a sitting or lying position.
No, postprandial hypotension. Sudden drop in blood pressure after eating. What is the Shy-Drager syndrome?
Progressive damage to the autonomic nervous system.
Yes, it causes that. What is the drug Midodrine used for?
It is used to raise standard blood pressure levels
Yes.
in people with chronic orthostatic hypertension.
No, page 26, potassium. When you have too little potassium in your diet, too much sodium can accumulate in the blood, and sometimes that causes your high blood pressure. And know your high blood pressure risk factors. Treatment and drugs. Know them beta blockers. What do? Reduces the workload on the heart and opens blood vessels, which cause the heart to beat slower and with less force. They're really going deep like that. Use that. Your calcium channel blockers helps relax the muscles of the blood vessels. Some can also slow the heart rate. Know that it can also slow the heart rate. Know that your alpha beta blockers reduce nerve impulses and slows the heart rate. They're a mixture of medications. Y'all know what a sphygmomanometer is. Do not forget that. How long do you count your respiratory rate? If you have tachypnea, how many breaths is it? 20 plus. Anything over 20. We don't really consider it until it's like 22, but book-wise, we're going to go 20. Bradypnea, what is your breaths?
Lower than 12.
And if you're apnea, anything with A means absent. All right. Heart rate. Pulse can be felt any place that allows an artery to be compressed against a
Bone.
What can affect your heart rate? Medication, trauma, illness, temperatures, exercise, stress. And there's lots of that. It keeps on going. Illness can also affect it as well. Illnesses such as a fever will put an increased metabolic demand on the body, and the heart rate increases due to oxygen requirements. What happens to your heart rate if you have a fever? It increases, yes. What is arteriosclerosis? Buildup of plaque in your arteries. If you have tachycardia, what's your pulse?
Over 100.
If you have bradycardia,
Lower than 60.
arrhythmia,
abnormal.
abnormality. Yeah, A can stand for abnormal as well. Heart measurement. When you're feeling a pulse, what fingers should you use? Your finger and your middle finger. Your index finger and middle finger. The thumb you do not want to use because of what?
It has an envelope.
With the use of an EKG, which the other name is electrocardiogram, also called ECG, it measures heart problems, and a more precise measurement can be made. I don't know. Just know that as well. What does the EKG measure?
The electrical function of the
Electrical impulses of the heart. Another name is the electrocardiogram. Underline and make sure you know that. That is not an X-ray. Is the electrocardiogram an X-ray? No. The average brain of adult weighs how much? Spinal cord is how long?
17.
What is the connective tissue membranes that separate the brain from the skull?
meninges.
What is your somatic nervous system? What is your somatic nervous system?
Your
What does it do?
skeletal involuntary.
Yeah.
And is it what?
Just a voluntary withdrawal body.
Voluntary and use skeletals. Autonomic. You have 3 parts. What are they?
Nervous, parasympathetic, and
Sympathetic, parasympathetic, enteric.
right.
What is the sympathetic used when you do what?
With mobilization,
Under stress. Parasympathetic,
okay, body at rest,
at rest. And your enteric.
gastrointestinal.
That's happening all the time. Using your gastrointestinal system. Cerebral cortex, what does it do?
Movement, language,
Brainstem, what does it do?
Heart rate, breathing, blood pressure.
Cerebellum, what does it do?
movement, posture,
Hypothalamus, what does it do?
Thirst, hungry, body temperature.
Thalamus, what does it do?
Movement.
Limbic system, what does it do?
memory, emotion,
Basal ganglia, what does it do? Midbrain.
Vision, eye movement, body.
So do we need to know that whole page?
Yeah.
Yes. What do you use to determine someone's vision?
the Snell chart,
What's the good vision?
2020.
What is the ringing in the ears called?
Tinnitus.
What is hyponosmia?
When you can't smell,
Hypo means
when you
you smell decreases. What about anosmia?
can't smell it all.
There you go. Know the difference. Don't put them in the same category.
I do.
What is the receptors for taste buds called? Or no, what are the receptors for taste called?
Okay, taste buds.
Taste buds.
What is hypogausia?
Condition,
Can't say.
reduced the taste.
Reduce. Can't say can't. Because you got agausia means
You can't taste it all.
can't. All right. Now for your skin, which is your organ of touch. What is congenital analgesia? No sense of pain. What is a cataract?
Clotting of the lens,
How we gonna fix it?
surgery, glasses,
What is epilepsy?
a seizure,
What are your different kinds of seizures?
absent seizures, focal, and grand mal.
Petite mal is also known as absent seizures. What is the EEG?
Electro,
Encephalogram. Encephalo, anything that is head. So do you put an EKG on somebody when you're checking for seizures? No. EEG. Encephalo. Electroencephalogram. What is glaucoma? Damage to the...
optic nerve,
What is Parkinson's disease? Degeneration of...
brain cells,
What is a tumor?
a collection of
Abnormal cells. What's inspiration mean?
inhaling,
Expiration.
exhaling,
What's another name for your throat?
trachea,
Pharynx.
pharynx,
What's another name for your windpipe? What's in your upper respiratory tract? All the way down to that trachea. And your lower respiratory tract?
lungs, bronchi, bronchioles, alveoli,
What's another name for nostrils?
nares,
What is shared with the respiratory and the digestive system for your respiratory?
the pharynx,
Pharynx. What's another name for the larynx?
throat,
Voice box. Voice box. The bronchi. What's the left bronchi? How many lobes does it have? And the right one has 3. The lungs have a what? That's where lymphatic nerves and bronchial tubes come into. What's that slit called?
A helix.
Helix. Same as your kidney. Kidney's got that same thing where everything goes in at that spot. And especially your bronchial tubes. Apnea. If apnea occurs, what are we going to do?
CPR.
Artificial respiration is required. And know this because they try to get you on this one. Artificial respiration refers to the measures taken to cause air to flow into the lungs by expansion of the chest cavity. So what are we going to be expanding?
The chest cavity.
Don't let that one fool you. Diphtheria is caused by bacteria. What are we going to use to determine immunity?
A sheep test.
Yes. Measles. What's one main part of measles? How are you going to know they got it? It's their eyes. Eyes. Eyelids swollen. Inflamed eyelids. It's all about the eyes. Because they can't see. You want to put them in a dark room. It just messes up their eyes. Most infectious stage is called the what?
The most infectious stage of measles.
Yes. The cortisol stage. Incubation period is how long?
8 and 12 days.
8 to 12. They're going to be sensitive to.
Light.
How are we going to diagnose it?
A serology test.
Pretty much draw the blood. And make sure you protect the eyes from sunlight. Pneumonia is caused by what? Most common cause is
Bacterial viruses.
we're going to give them medication. What's the medication we're going to give them? It's bacteria. Antibiotics. Scarlet fever. What is the test to determine susceptibility? The test to determine.
Oh, a dick test.
Yes. And what's the bacteria called? For sinusitis. What is used to drain sinuses? Argyrol. I don't know how to pronounce it either. Argyrol. Tuberculosis is caused by what?
Infection by bacteria.
What age is it most common in?
15 to 30.
How are we going to test it?
Biopsy of the lung.
And what we're going to give them?
CT scan, X-ray.
That's for diagnosis. What we're going to give them for medication?
That's what I was talking about earlier.
Rifampin.
Oh, that's not rifampin.
What is the only vein that has oxygen?
The only vein that has oxygen is the pulmonary vein.
Pulmonary vein. What does the aorta do? That is the big one.
Oxygen-rich blood from the left ventricle out of the body.
All into the body. What happens in the capillary? Capillaries. Exchange of water and chemicals between blood and tissue. Everything. What are the organs, or what do they do? Page 53.
They exchange oxygen and carbon dioxide
Between what?
the lungs.
The air and the blood. The lungs are where it's taking place, but what's happening is an exchange between air and blood. How many molecules does hemoglobin have?
4.
Or carry, I should say. Carbon dioxide spreads from the blood into what? The arterial system is developed in how many weeks?
4 to 8.
Arteriosclerosis is what?
Cardiac organ.
Disease characterized by buildup of fatty deposits. What is edema? Too much fluid in your body. What can cold applications help hemorrhages? Yes. What is thrombophlebitis?
Swelling or inflammation of the vein or vein.
By a blood clot. The muscular system is the system that allows for what? What else?
Balance, strength, and posture.
The muscular system is divided into 3 groups. What are they?
Cardiac, smooth, and skeletal.
The skeletal is part of the what nervous system? Somatic. The smooth is part of the autonomic. Put those together. Musculoskeletal system, one of its basic functions is to make what? What are musculoskeletal? So they're talking about the mixture. Blood cell formation. What is another name for blood cell formation? Hematopoiesis. What's a ligament? Bone to what? Tendons are. What is a fibroblast? It is the mother cell. It makes everything else as far as the musculoskeletal system. Can a sedentary lifestyle make bad circulation?
Yes.
In the arm, do you have a bicep brachii muscle?
Yes.
And a tricep brachii. You need to know and circle that. Page 60. Bicep brachii moves forearm close to the body where the tricep moves it away. But you be pushing with the tricep. Pulling with the bicep. Know those differences and those cramps, strain, sprain. You'll be fine with that. Y'all did pretty good on that one. Anatomy. The skeletal system consists of what kind of bones? Fused, as well as individual. Organic material makes up how much of your bones?
2/3.
Inorganic salt composes how much?
1/3.
What type of connective tissue is impregnated with inorganic salts? Bones. A typical long bone has a what and a what? The medullary cavity is the central part of the long bone and is filled with what? The medullary. There's not collagen in your bone. The medullary, God, I said it right one time. Cavity is the central part of the long bone and is filled with what? Bone marrow. Y'all know that. Even when you're eating chicken, that's what's in there. Marrow. The ends of a long bone is made of what kind of bone? Yes, calcaneus or spongy bone. Know the arteries that supply the bones and which ones if left out, you'll know that it was left out. The nerves supply the bones. Know that Hilton's law. If it supplies the nerve, it supplies the bone. That's all it's saying. Know what blast mean? Those are the beginnings of your cells. No, ossification is another name for making bones. Know your function of the bones. You have 3 functions. What are they? Page 67. Mechanical, synthetic, and metabolic. Now break down what is the synthetic function. What does that mean?
Synthetic making function.
Making blood cells. What's another name for making blood cells? It's not there. This is one of your test questions. Hematopoiesis. Know that hema, that's blood. Poiesis is making new blood. What are the 3 metabolic functions of your bones? Balance. What minerals are found in bones?
Calcium and phosphorus.
Yes, make sure you know the difference between the synthetic function and a metabolic function. Synthetic is making those blood cells, whereas the other is storage and regulation. Cartilage is composed of what?
Cells known as chondrocytes.
Yes, together with,
Collagen or yellow is elastic fiber.
yes, chondrocytes, collagen, yellow elastic fibers. Calcium salts are not present in a cartilage matrix, but chondroitin is. So what may be present in cartilage? Not calcium salts, but chondroitin. There you go. Joints. In the way joints are formed, they are able to keep what between stability, movement, and strength?
Junction.
In the way the joints are formed, they are able to keep a blank
Oh, keep bone.
balance between stability, movement, and strength. That's so you can be coordinated. What is another for your freely movable joints in your body? They're freely movable. Synovial. Know what your ligaments is? That's bone. It's bone. Your axioskeleton. What is it? What does it consist of? Thoracic cage. Know that it's your axial is straight up and down, your axis of your body, your head, your neck, your chest cavity. What's another name for your chest cavity? What's another name? The name I'm looking for. Thoracic cage. It's a bony cage that encloses your organs. It's located in the chest. How many ribs we got?
12.
How many bones in the upper limbs?
30.
How many bones in the lower limbs?
30.
The skeleton gives what to the body? Page 71. Body strength. There you go. Production of red blood cells. What's the other name? It don't go away. Hematopoiesis.
Yeah.
And it has hematopoietic activity. That means it's making blood cells. They're telling you where it is done at. What is diagnostic radiology? What do you do if you're carrying an X-ray film? What do you keep it away from?
Light.
Did nobody tell you that? Look in your book. Y'all don't know, look in your book.
If you're doing,
Page 73. That should be, you should know this. This you should know.
The X-ray.
Yes, and what we're going to put it in? Lead container. What is projection radiography? It captures the shadow. Where's your fluoroscopy? Is used to view the cardiovascular system, called angiography. Know what dual energy X-ray is? It's used for osteoporosis. And computed tomography. A lot of people know about the CT scan. What does it do? Ionizing radiation with the computer. That's it. And know these as well. I gave you these. I don't know if you've looked them up yet. Pilogram, Barciogram, GI series. Look those up and find out whether they are X-rays or not. Pilogram, Barciogram, and GI series. Find out, are they X-rays? Page 74. What is a bone disease that leads to an increased risk of fractures?
Osteoporosis.
What is the most common cause of osteoporosis? Menopausal, right. If they have osteogenesis imperfecta, which is brittle bone, what we're going to give them? What medication? Biphosphates. Biphosphates. What's a sprain? Sprain to the what? What do you sprain? What do you sprain? What part, body part? It's your ankle. There's all kind of things in your ankle. Y'all got y'all got to dig a little deeper. What do you sprain? It's a joint. What in there?
The cartilage.
No. Not cartilage. That's way off. Y'all there. Y'all warm. That cartilage is way off. Sprain. What do you sprain? Okay. Now let me ask you. What do you strain then?
You strain the muscle.
Okay. What do you sprain?
Bone.
Y'all ain't spraining no bone.
You strain the muscle. So that'd be a ligament. Or
Yes. Get those right in your head. Arthritis. What's another name for the therapy that you might use?
physical therapy.
Or, and this is what I wanted on your test. Diet.
Therapeutic.
Diathermy.
Diathermy.
Uses temperatures to help with it. There are two main parts of the reproductive system. One is your, they produce, and the uterus
Yeah, not the testes.
that passes a male sperm through and carries fetus. Ovaries produce one and what?
You said what now? Ovaries produce more than
Eggs and what else? And hormones. There you go. An average cycle lasts how long?
28 days.
When does the follicular phase start? Y'all just had this question.
The follicular about 14 days after.
First day of your period, right? 14 days. First day of your period. I think y'all need to learn it that way.
What you say? 14 days?
Yes.
The follicular phase starts on the first day of the period.
Yes.
First to 14 days, is that what it comes?
Starts on the first day of your period, though.
The Medullary Phase.
And that's what you want to start. Everything starts at your follicular phase. I think somebody might have got that wrong, and I didn't check it right. The follicular phase starts on the first day of your period. What triggers that? What?
Estrogen?
Yes, hormone. It's estrogen. Ovulatory phase. When does it start?
14 days after the follicular phase.
Yes, it's about the midpoint of your menstrual cycle. Luteal phase.
Begins after ovulation.
Yes, and we also call it this is when you have your period. That's your actual period. Follicular phase is just building up. Your ovulatory is when your eggs get ready. If that don't happen, the luteal phase begins. Regardless, it's going to thicken up your uterine walls. Either it's going to lay an egg, or hold an egg, I should say, or you're going to put that out. That's what they call the luteal. Luteal just means to get on out of there, as far as women are. What's a pelvimeter?
A what?
Pelvimeter.
A pelvimeter.
Oh, she acts like she never heard that word in her life. It does what? Kimberly?
Determine a female's pelvis in relation to.
Yeah, measures pelvis. Pelvimeter. Y'all don't think too hard on that.
What page you on, Kim?
After giving birth, women experience physical and emotional changes. What do we give them? After birth. Where are you going to send that child? Or the mother is going to what unit? Postpartum. You ever heard of postpartum depression? That's after the baby. You go to a postpartum part, or you're in that category, I should say. The first trimester is how long? What is the male hormone? Seminal vesicles produce fructose to provide what? With energy. That was something I just was amazed about. When I learned that, early in life. Seminal vesicles produce fructose to provide what with energy?
Sperm.
What? Birds.
Sperm.
Yes, sperm. Yes. That is sperm energy, which is fructose. Bacterial vaginosis causes what type of symptom?
Abnormal discharge.
Yes. Chlamydia is caused by what?
Bacteria.
Called?
Chlamydia trachomatis.
Yes. And it will damage your reproductive organs. You get that? You may not have children. Gonorrhea. What's it caused by?
Bacteria, Neisseria.
Gonorrhea. And what are we going to give them? What's the incubation period of hepatitis A?
28 days.
Caused by what kind of route?
Fecal.
Fecal oral.
That's gross.
Hepatitis B. What's the incubation period?
6 weeks to 6 months.
Hepatitis C. What's the incubation period?
1 to 6 months.
What's the incubation period for herpes?
6 to 8 days.
Is there a cure for herpes?
No.
How are we going to diagnose HIV? There's 2 tests. The ELISA test and the
Western blot test.
black, Western black. Pelvic inflammatory disease is an infection of the reproductive system and their organs. Syphilis is caused by the bacteria Treponema pallidum. What's the antibody test that we can use to determine if you have syphilis? The test to determine the Wassermann test. Or Wassermann. Trichomoniasis is caused by what? Vaginalis. What is infertility?
The inability to reproduce.
Contribute to reproduction. Impotence. They get hard. Bile, B-I-L-E, is what? It's a digestive chemical. It's produced in the
Liver.
stored in the secreted into. Get that in your head. Gallbladder is a small light organ that stores and releases.
Bile.
How do you spell that?
B-I-L-E.
Liver filters toxins from the blood and produces bile. What happens in the mouth?
The salivary gland. The
First part of the digestion.
digestive tract.
And what produces or begins the process of digestion?
Salivary gland.
What is the pancreas?
Insulin.
Enzyme producing.
Yes, enzyme producing gland, but yes, insulin. What does the salivary gland start to break down? Such as carbohydrates. What is the stomach? Sac-like muscular organ. If you smell food, what's going to come out your mouth? From the salivary glands. And that's where digestion starts. What is the esophagus?
You connect the stomach, connect to the stomach.
Yes, the muscular tube. That's what's got all the peristalsis that moves the food down into. Food travels from the stomach to the small intestines, which is made up of 3 parts. What are those 3 parts? First one is your duodenum, then your jejunum, and then your ileum. How long does it take stool to
30
form?
pounds.
Your vitamins are put into 2 groups. What are they?
That's how it works.
What's a strong antioxidant?
Vitamin
What's a very strong antioxidant? Vitamin K is found in what?
Spinach, cabbage, broccoli.
Yes. What does potassium do as a mineral? It works with sodium and
It binds.
Regulates the water level of the body?
regulates the water level. Yes. Know what a biopsy is? Well, know your definition for dyspepsia? Just indigestion. Know your symptoms and signs for a gallstone and what we're going to give them to help them out.
Grapefruit juice, medicine, or surgery.
Lactose intolerance is caused by not having what?
Lactase.
Which is the enzyme. How many kidneys do we got?
2.
And how are they positioned in the body?
They tilted toward the spine.
Yes. And what do you call that thing that goes into the kidney? Helix, just like your lungs, same thing. Got a little one there. Once the bladder is filled with urine, what holds or releases that urine?
Your sphincter.
That sphincter. Urethra is how long in women?
6 to 8 inches.
And the
Oh, 1.5 long.
is either or. For women, did I say women?
Yeah,
Yeah,
1.5. The sphincter, the urethra sphincter, is controlled by what?
Urine flow from the bladder.
Muscles and nerves. Oh, excuse me. And that's why if people have a stroke, that's a lot of times affected. Know what is in the glomerulus. Know your Bowman's capsule. We just went over all that. Know what's happening in that distal convoluted tubule. Know all of that. Know about the parathyroid. Remember that. Know about your aldosterone. Know that. And your atrial natriuretic peptide. What is it doing? What is the first thing to form urine? What's the first step? Filtration. What is secreted when making urine? The substances that are secreted are potassium ions, hydrogen ions, ammonia, and certain drugs. Y'all know that kidneys are responsible for what? Page 102.
Reabsorption of water.
Water, salt balance, yes, that too. Balance of the blood. How does it reabsorb water? Using what hormone?
88.
The antidiuretic, which controls the water excretion. Reabsorption of salt is used in or controlled by what hormone? Reabsorption of salt. What's the hormone there?
Sodium.
Aldosterone. Sodium is not a hormone.
All the reabsorption.
How about your atrial natriuretic hormone? Where is that?
In the heart.
In the heart. That helps release sodium as well. You got hypernatremia. What is that?
Sodium. Oh, this ain't potassium, sodium level above normal.
What does diuretics do?
What is?
It flushes.
Yeah, flush it.
Yeah. Causes sodium and water to be lost through your urine. Know what pyelonephritis is? Pyelo, anything is kidney. Itis, we already know it's swelling. Know what your kidney disease is? What puts a person at risk for kidney disease? High blood pressure, diabetes, heart disease, kidney disease. Glomerular disease. Remember about that foamy urine? That's going to be a sign. Kidney stones. Remember, it's pain, 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 pain. And how are we going to fix it? By lithotripsy. If you have urinary retention, what may we have to do?
Get you a catheter?
Yes. What is sterilization?
Where you wipe out bacteria?
The difference where it wipes all. Yes, that's what the difference is. Sterilization, you're wiping it all. You can disinfect, that's not killing all. Sterilization is. Urinary incontinence is the accidental leakage of urine. Just know that. That's the fancy name for it. Cystitis, caused by what?
Bladder infection.
Bacterial. It's a bladder infection. We're going to give them antibiotic. What's the medical name for falling bladder? Y'all know that. Can damage to the nerves cause urinary incontinence?
Yeah.
Yes. Then your medical fields, you know your allergy, andrology, aviation, pathology, radiology, psychology. And make sure you know what therapeutic radiology is. Break it down. And urology. Do that every day. Just go through your stuff.